All right, hi again, guys. Dr. Sloan here again. So, going to go over a little bit about suturing technique. And so, this thing, first off, is not a good representation of the human body. So, if it's tearing through and you put the needle in, or it doesn't seem like it's coming together correctly, don't worry. Real tissue is very strong and doesn't do that. If you ever want to practice on real tissue, sometimes you can take like a chicken breast with the skin or like pork with the skin and use that. And that's a little bit similar to what real tissue will feel like, but nothing feels the exact same as real tissue. So first off, I want to go through the instrument that you guys have that came in this little kit. So these two look very similar. And what you notice is that there's a joint here and then some teeth up here. Now this one here, they're actually uniquely different. So the way to help you tell is first, this one has a much longer spout than this one. And secondly, if you look on the inside, it tells you what it does. So on the inside of this one, if you look up close, it has parallel lines. So parallel lines means it's really good at grabbing something against the lines like this, because then in order to slide out, it would have to hit each one of those lines along the way. If it wants to slide out, it would go click, 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 click all the way out. But if you grab it sideways like this, it's not so great at grabbing things because then it can just slide right out of those lines. So this would not be great for grabbing a needle because it only has lines in one direction. So if you grab the needle this way with it, totally fine as long as the needle doesn't slide. Totally fine because the needle can't slide up and down. But the needle could theoretically slide in and out in this direction, which is a problem. That brings us to this, and this is called a hemostat, by the way. Really good for tissue grasping because you're always grabbing perpendicular to the tissue, like I said, so it doesn't slide. That's compared to this thing. This is called a needle driver. Look at the inside of this one. Totally different. Let me see if I can get it in focus there. Try that. Totally different than the last one. This one has a crisscross inside, and by crisscrossing, what that means is that you can, sorry, we can't get in focus, guys, but crisscrossing means that you can grab it in any direction. So it's never used for grabbing tissue, although there are different types of pickups being these tweezer type things. There are different types of these that have insides like that for grabbing tissue. But with these, really good for grabbing a needle because I can grab the needle in any direction I want to. So I can front load it, which means to load it the correct way like this, where the needle's off to the left side. I could backhand it or backload it where the needle's off like this to the right side. I could even grab it right at the tip like this, which you'd never really do. But again, you can grab it in any direction because those crisscrosses mean that it won't slide no matter which way you're grabbing it. And every once in a while, you do have to change the direction depending on how you're trying to get in. So we'll get into that once we talk about suturing technique. And sorry if I'm talking too fast, guys. So next, these things. So we call them tweezers or pickups, but the true name for them is the Adson. That's with a D, A-D-S-O-N, Adson. And so these are for the skin only. If you were doing surgery on the inside, there are many different types of these that you'd use on the inside. But these, you hold them not like a pencil and not overhand or not like chopsticks. You want to hold them as if they're an extension of your fingers. So I'm right-handed, so I actually want to grab these with my left hand. And so I usually put them like this. If my fingers were just a little longer, basically these are my fingers. Here's my fingers, and if I wanted to grab something, I'd grab it like that. And now I'm just extending the fingers a little bit like that so that I can grab the tissue. So first you load your needle. Your needle always loads, if you hold your needle driver straight out like this, the needle loads perpendicular to that. Oops, and it spun, because these are crappy, by the way. Each one of these instruments would be $50 to $100 a piece, so you know these aren't nice ones, but perpendicular to the instrument like that. So you can see when you look from above, you can see it, and then when you look from this way, you can see it. And that's how you want it to be because you're going to be going right to left to go through the tissue. Now, another thing, you're not pushing through the tissue. The needle has a curve to it, as you can see, and you always want to utilize the curve of the needle. So when you get into something, you don't get into it and then you push. you get into it and then you spin or you supinate or you pronate your hand. So I'm getting into the tissue and then I'm curling my hand and using the curve of the needle. You'll hear that a lot on your clinicals, the curve of the needle to get it through. When you're taking it out, again, you're not going to grab here. Hopefully you guys can see that. You're not going to grab here and yank this out or pull this out. The needle is curved this way and I need to pull it out, finishing the curve. So I'm going to grab it here and I'm going to curl. See how my hand there is turning or supinating? I'm curling the needle through. I'm using the curve to get through. I'm not just grabbing and pulling. That's going to damage the tissue. I'm going to grab and turn the needle. So let's do some suturing because Shelby had mentioned that you guys have some trouble with the end of the tying because that part's really confusing. So I'm going to go through that. So first things first, you load your needle perpendicular. Next, you get your Adsons in there as an extension of your fingers. That'll make it easier. When you grab this, you grab the one side you're working on. You're always sewing towards yourself. So I'm grabbing a little closer to me than I'm going to go. I'm going to go up here, but grab down here. You curl it out so that the tissue is perpendicular now. There's a little ledge. You always want to go in with the tip of the needle at a 90-degree angle. So if I make, instead of this being flat, if I curl it this way like that, then the needle can go in flat, right like that, because this and this are perpendicular to each other. So I'm going to do that with the tissue here. I curl this up, as you can see with my hand there. Now I go right in perpendicularly and I spin. I don't push, and that brings my needle through. Now I grab the other side and I, in this case, supinate my hand or flip it upwards so that I get a perpendicular. And you can try to do that in one swoop. In real surgery, we do it in 2 different bites so that it's a little more precise. But you could reload your needle, flip up your tissue, and again, you want to get your tip in there and then curl it so that you're using the curve of the needle, and then curl it out so that's nice and smooth. You can do your instrument tie here, a double loop, 1, 2, grab the tip and pull it through. Oops, slid right through there. Okay. You'll notice it didn't close very nicely the first time because it wasn't flat, so making sure it's flat is important. Again, this is not normal tissue. It's very, very tense, and so that's one of the reasons that the surgeon's knot, which is usually supposed to hold tension, is unraveling. Next, you do it the other way, 1, and grab and pull, and that'll lock the first knot in place because, again, the 2-knot complex doesn't allow the lower knot to slide. Do it again, maybe 3 or 4 times total. We're going to go that way, moving this string that was on the left to the right, and then one last time, moving it from the right back to the left. And that normally would be nice and tight. You also, in the operating room, have someone holding this one tight to keep everything tight. So you reload, you do your next several stitches, again, loading this perpendicular, making this an extension of your hand. You grab here and you curl it out. You go in perpendicular. If you want to go through all of them at once, instead of curling all the way through, you can leave it halfway down and then curl the rest of the way through. Another trick, don't leave your fingers in here. Once you load it, grab this like this and put your finger there. That gives you a lot of stability. Yes, it's annoying to move your fingers back, but you can see I can do that one-handed. With a little bit of practice, you'll be able to do that one-handed too. This thing here, this is not for grabbing the needle. You did see me grab the needle with it, and that was improper. There is an instrument for that called a Russian, but most of the time the tissue forceps, as this is really known, or in this case the Adson, is used to hold the tissue tight so that you can grab the needle. Now in real skin, this tissue is trying to pull apart, and what that will do is it'll slide the needle out. Like as it tries to pull away, the needle gets smaller and smaller. So your job is to hold the skin close together so that the needle can't slide out, and then grab the needle with your needle driver and pull it through so that it's a nice steady pull through and that the tissue doesn't pull apart. And sorry that got caught in there. So you do it through these throws. This is just a simple a simple running stitch. And then you do those, again, tissue forceps holding the tissue, pulling through. You can reload. Do it again. If you're thinking that you didn't do it right because your string is coming across diagonally like this, then you're wrong. You did do it right. It's supposed to be inside going across perfectly straight, but then then you have to move up a little bit. And so when you move up to do your next stitch, you're going to get this diagonal throw there. And then finally, how to end. So let's do one more, and I'll show you how to end. So you go through here, you curl through there. Now, instead of pulling this through where this tail here gets taut, I'm going to curl that through and then leave the tail there. Now you can do your instrument tie using the tail. So you loop this around, and I didn't leave myself a lot of slack. 1, 2, grab your tail and pull it through. Now another thing with this, if you just pull on the tail, it's not going to lay very flat, and it's not going to get very tight. And you might wonder why. The reason is that this is actually two different knots. It's a knot with this side and the top loop here, and this side and the bottom loop here. So you got to actually pull on both loops. So usually I tighten it, and then if there was enough room, I'd put my finger in there and I'd push on the left side. So here I'm going to grab it and push on the left side. Sorry you can't see this very well, but I'm trying to make it easy. Here's the left and the right. So I'm going to push on the right side while I'm holding it tight, like that. Then I push on the left side while I'm holding it tight over there like that, and that'll make your knot really, really tight. You got to push on both sides. And then you do your surgeon's knot, and you grab the loop again and you pull it through. Now the surgeon's knots these square knots are 2-knot complex. So I would do the same thing on this one. I push on the right side, I push on the left side, right, left, right, left. Try to make sure that they're both tight. You only have to do that the first time, because if your first knot's tight, it doesn't really matter if your other ones are super tight. You can see here there's a little loop sticking up. I'm not sure if you guys can see that there, but that's because I didn't pull on both sides. So pulling on both sides will allow it to really tighten. And then that's your knot, and then you're done. And then one thing you can do if you want to, and I don't think you guys learned this in class, you can cut off this little double loop there like that. And then you can see here that the knot is above the skin right there. So you can actually grab your needle and go into the skin. Hard angle for me here, so I apologize, but if you go into the skin, you don't want to go too far away from the knot, but kind of underneath the knot, you can actually bury the knot. So what this will do, this string here, which now went underneath, is going to pull this knot into that hole there. So if I do that, the knot, again, this is not real skin, but you can see the knot starting to move and kind of hiding in that hole there. So that's how you bury the knot. And then you can just cut this right there on the skin so that the patient doesn't see any knots. This one didn't bury so well, but again, this is not real skin.